CPC Exam Questions and Answers PDF AAPC Practice Test 2026. Question 1. A hospital inpatient underwent 5 different radiation therapy sessions. Each session involved a single treatment area and parallel opposed ports. A total of 5 MeV of energy was delivered during each of the treatment sessions. How should the hospital report the delivery of this radiation treatment? Option A, 77,402x5. Option B, 77,427. Option C, 77,407. Option D, 77,406. The correct answer is option A, 77,402x5. A, 77,402x5. Question 2. A patient underwent a complete course of radiation therapy involving a total of 7 fractions, i.e., treatment sessions, over a 2-week period. Each fraction involved multiple treatment areas. A total of 10 MeV of energy was delivered during each of the treatment sessions. How should the radiation oncologist report the radiation treatment management services he provided in connection with this course of therapy? Option A, 77,427x7. Option B, 77,427. Option C, 77,427, 77,431. Option D, 77,413x7. The correct answer is option B, 77,427. B, 77,427. Question 3. Mr. Mays was treated for prostate cancer 5 years ago. Mr. Mays is now presenting to the hospital for a PET, positron emission tomography, scan for tumor imaging of his head for detection of brain metastases. The physician concurrently performs a CT of the head without contrast to localize the anatomic location to be studied. During the same encounter, the same physician also performs a CT of the chest without contrast to determine the cause of Mr. Mays' severe chest pain he has been experiencing over the past few months. How should the physician's professional services be reported? Option A, 78,814 to 26, 70450-26-59, 71250-26-59. Option B, 78,815 to 26. Option C, 78,814 to 26, 71250-26-59. Option D, 78,814, 71,250 to 59. The correct answer is option C, 78,814 to 26, 71250-26-59. C, 78,814 to 26, 71250-26-59. Question 4. A physician ordered an electrolyte panel from a local laboratory company. The order form supplied by this company indicates the following tests are always included whenever an electrolyte panel is ordered: carbon dioxide, chloride, glucose, potassium, and sodium. The lab company performed all of these tests. How should the lab company report these services? Option A, 82,374, 82,435, 84,132, 84,295, 82,947. Option B, 80,051, 82,374, 82,435, 84,132, 84,295, 82,947. Option C, 80,051. Option D, 80,051, 82,947. The correct answer is option D, 80,051, 82,947. D, 80,051, 82,947. Question 5. Multiple drug class chromatographic drug testing was performed to determine whether a patient had amphetamines and opiates in his system. A single stationary phase was run to test for both drug classes. However, 2 separate mobile phases were required to complete the testing. How should these lab services be reported? Option A, 80,100x2. Option B, 80,101x2. Option C, 80,100, 80,101. Option D, 80,100. The correct answer is option A, 80,100x2. A, 80,100x2. Question 6. A lab performed a calcitonin stimulation panel consisting of 3 separate calcitonin tests. How should these lab services be reported? Option A, 80,410, 82,308x3. Option B, 82,308x3. Option C, 80,410. Option D, 82,308, 82,308 to 91x3. The correct answer is option C, 80,410. C, 80,410. Question 7. A pathologist was asked to consult on the results of a quantitative urine alkaloid test taken in a primary care physician's office. The pathologist reviewed the test results but did not review the patient's records or personally examine the patient. A written report was produced by the pathologist rendering his opinion and sent back to the primary care physician's office. How should the pathologist's services be reported? Option A. The pathologist's professional services should not be separately reported, they are a part of the lab's overhead. Option B, 80,500. Option C, 82,101, 80,500. Option D, 82,101. The correct answer is option B, 80,500. B, 80,500. Question 8. A 6-year-old child was taken to the hospital emergency department after swallowing a lead toy soldier. A lead toxicity test was performed immediately and the patient was started on 4 infusion of a detoxification agent. 3 hours later, a lead test was run again to determine whether the 4 infusion was reducing the level of lead in the patient's blood. How should these lab services performed in connection with this encounter be reported? Option A, 83,655. Option B, 83,655x2. Option C, 83,655 to 91. Option D, 83,655, 83,655 to 91. The correct answer is option D, 83,655, 83,655 to 91. D, 83,655, 83,655 to 91. Question 9. A physician aspirated a sample of bone marrow and then interpreted a smear from the sample. How should the physician's professional services be reported? Option A, 38,220, 85,097. Option B, 38,220, 88,305 to 26. Option C, 38,221, 85,097. Option D, 85,097. The correct answer is option A, 38,220, 85,097. A, 38,220, 85,097. Question 10. A quantitative colony count bacterial culture of the urine was performed with isolation and presumptive identification of isolates. How should these lab services be reported? Option A, 87,040. Option B, 87,070. Option C, 87,075. Option D, 87,088. The correct answer is option D, 87,088. D, 87,088. Question 11. Cytopathology slides prepared from a vaginal specimen were manually screened with computer-assisted rescreening using cell selection with the Bethesda system of reporting. This service was performed by lab personnel under physician supervision. The initial results were positive. The pathologist then reviewed the initial test results and rendered an interpretation. How should these lab services, including the physician interpretation, be reported? Option A, 88,154. Option B, 88,167, 88,141. Option C, 88,154, 88,141. Option D, 88,142, 88,141. The correct answer is option B, 88,167, 88,141. B, 88,167, 88,141. Question 12. A patient who had developed a tumor on his tonsils underwent surgery for resection of the tonsils. After the tonsils had been removed and the patient was sent to the recovery room, the tonsils were sent, as a single specimen, to the pathologist for gross and microscopic evaluation. How should the pathologist's services be reported? Option A, 88,305 to 26. Option B, 88,304 to 26. Option C, 88,309 to 26. Option D, 88,399 to 26. The correct answer is option C, 88,309 to 26. C, 88,309 to 26. Question 13. A patient presented for a colonoscopy. The gastroenterologist biopsied 3 polyps from the colon and sent each polyp as a separately identified specimen to pathology requesting a pathology consult while the patient was still on the table. Tissue blocks and frozen sections were then prepared and examined as follows. Specimen 1, first tissue block 3 frozen sections, second tissue block 1 frozen section. Specimen 2, first tissue block 2 frozen sections, second tissue block 4 frozen sections. Specimen 3, single tissue block 3 frozen sections. How should the pathologist's services be reported? Option A, 88,331 to 26, 88,332 to 26x5. Option B, 88,331 to 26x3, 88,332 to 26x10. Option C, 88,331 to 26x8, 88,332 to 26x5. Option D, 88,331 to 26x3, 88,332 to 26x2. The correct answer is option D, 88,331 to 26x3, 88,332 to 26x2. D, 88,331 to 26x3, 88,332 to 26x2.